Welcome to Elder Secrets, where untold truths of aging come to light. In today's episode, we're pulling back the label on something millions trust daily: senior vitamins. You've been told they're essential, but what if the very pills meant to protect your health are quietly doing harm? Stay with us as we expose the hidden danger in senior vitamins.
Welcome to The Deep Dive. We're here to cut through the noise, find those crucial bits of knowledge, and really help you get informed.
And today's topic is, well, it's a big one. It affects millions, often in ways they don't even suspect.
It really does. Picture this. Margaret, maybe 72, retired teacher. She goes into the pharmacy, looking for a boost. More energy, stronger bones, maybe keep her mind sharp. And she sees these aisles just packed with vitamins labeled senior formula. They promise all that stuff. So 68% of folks over 65, she buys one. Thinks she's doing the right thing.
Absolutely. But here's the catch. What Margaret, and honestly so many others, don't realize is that this seemingly smart choice, it might be overloading her with certain nutrients.
Or worse.
Or worse, yeah. It could be seriously messing with the medications she actually needs.
And this isn't like a one-off thing. It's systemic. It affects older adults everywhere.
It is.
So that's our mission for this deep dive. Let's pull back the curtain on this whole senior vitamin industry.
Right. We need to understand how these supplements are different, why the body handles nutrients differently as we age.
And crucially, what hidden dangers you really need to know about.
Exactly. The goal is to give you the knowledge to make safe, informed choices, not just grab a bottle off the shelf.
Okay, let's get into it. The sheer size of this market is, well, it's huge.
Oh, it's massive. Over $50 billion a year just in the U.S. for vitamins and supplements.
Wow.
And the senior-specific stuff, that's one of the fastest-growing parts of it.
You see it everywhere, those 50-plus formulas. And it makes sense why they appeal, especially to boomers. They're often seen as, health-conscious, willing to spend on staying well.
Right. And Dr. Sarah Chen, she's a geriatrician at Johns Hopkins, she points out seniors are dealing with a lot. Energy levels dropping, bone density worries, cognitive changes, maybe managing chronic conditions.
Yeah, several things at once often.
Exactly. So the idea of a single pill that might help with all that, it's incredibly appealing.
But here's where it gets interesting, and maybe a bit concerning. How they're marketed.
They don't go through the tough FDA approval like drugs do. Instead, the companies use words like healthy aging, vitality, wellness.
It's clever marketing. It avoids the drug regulations. This whole situation stems from the Dietary Supplement Health and Education Act of 1994, DSHEA.
Right, DSHEA.
It basically treats supplements more like food than medicine.
Which creates this blind spot. Dr. Robert Martinez at UCSF calls it a knowledge gap.
That's a good way to put it.
He says we know tons about how aging affects prescription drugs, but surprisingly little about high-dose vitamins and minerals in older bodies.
He calls it a perfect storm for unintended consequences. And it really can be.
And this feeds into that whole more is better idea, which can be so dangerous here.
Definitely. Seniors might take a multi, then maybe something extra for bones, something for eyes. It adds up fast.
Like vitamin A, for example, lots of senior multis have, 1,500 to 2,400 micrograms?
Right, and the upper limit, the safe upper limit, is 3,000. So you're getting close just with the multi. And that doesn't even count vitamin A from food or the fact that your liver might not process it as well as it used to. You can easily go over that limit.
And the labels don't help. They can be incredibly confusing.
Oh, tell me about it.
Different units, micrograms, IU, milligrams, different forms of the same vitamin. Some researchers call it supplement chaos.
Supplement chaos, I like that. Plus, you buy stuff online and algorithms push you to buy more things to stack supplements.
Exactly. It makes it almost impossible for you, the consumer, to keep track of your total intake.
So the irony is just, it's stark, isn't it? Seniors might actually need certain supplements more because of absorption issues, but they're also the most vulnerable to harm from those same supplements because of bodily changes and drug interactions.
Precisely. It's a real double-edged sword.
Okay, so we've got the industry side, the regulations or lack thereof. Let's talk about the aging body itself. What actually changes?
Well, Dr. Lisa Wang, a geriatric nutritionist at Stanford, put it really well. She said, the aging process affects every aspect of nutrient handling. Every single step.
From putting it in your mouth to getting rid of it.
Exactly. From ingestion to elimination. Let's start with absorption. A big one is stomach acid.
Okay.
It often decreases as we age. The condition is called aclohydria, basically, low stomach acid. Up to 40% of people over 65 might have it.
40%. Wow. And that affects...
It makes it harder to absorb nutrients that need acid to be released, especially B12 bound to protein and food, also iron and calcium.
Okay. So that leads to the B12 paradox you mentioned earlier.
Yes, exactly. Seniors struggle with food B12.
Yeah.
So supplements have huge doses, right? Synthetic B12, maybe 100 or even 1,000 times the RDA.
Sounds like it thinks.
You'd think so. But the body has this gatekeeper called intrinsic factor. You can only grab about 2.4 micrograms of B12 at a time, no matter how much is there.
Only 2.4, even with those massive doses.
Right. The rest has to rely on something called passive diffusion, which is super inefficient. Maybe only 1% of a really high dose gets absorbed that way.
So you're taking huge amounts, but getting very little extra benefit.
Pretty much. And worse, that excess might not just be useless. There are emerging concerns, linking chronically high B12 levels to increased cancer risk, maybe immune issues.
So more is better is definitely not the case there.
Definitely not. And it's not just stomach acid. The intestines themselves become less efficient, less surface area, fewer active transport proteins for things like calcium, iron, B vitamins.
Okay, calcium, that's a big one for seniors, right? Bone health.
Huge. But calcium absorption drops dramatically, maybe from 60% when you're young down to 20% or less.
20%?
Yeah. So you see these supplements with 500, 1,000, 1,200 milligrams per pill.
But your body can only handle so much at once.
Exactly. It maxes out at absorbing about 500 milligrams of elemental calcium at one time. Dr. James Thompson at Mayo Clinic, he's a kidney specialist, he says seniors often take 2,000, 3,000 milligrams a day total, way more than they can use.
And that excess calcium isn't just wasted, it causes problems.
It can. It messes with absorbing other minerals, magnesium, iron, zinc. It can contribute to kidney stones.
Ouch.
And, more concerningly, there's growing evidence linking high calcium intake, especially without enough vitamin D, to cardiovascular risks.
Like heart attacks.
Heart attacks, stroke, calcification of arteries. It might even interfere with blood clotting. It's not benign.
Okay, so that's absorption. A lot changes there. What about after the nutrients get in? Metabolism, elimination?
Right. That's the next stage. And yeah, the aging body handles this differently too. Liver function, for instance.
It slows down.
It generally becomes less efficient.
Yeah.
And that really impacts the fat-soluble vitamins, A, D, E, and K, because they're stored in the liver and fat tissue.
So vitamin A again, what's the issue there with the liver? It's kind of a double whammy for seniors. First, the body gets less good at converting beta-carotene from plants into active vitamin A.
Okay.
Second, the less efficient liver has a harder time eliminating excess preformed vitamin A, the kind you find in supplements and animal products. So toxicity risk goes way up.
And vitamin D. Lots of seniors are told they need more D.
Many do, yeah. But they're also more sensitive to getting too much. The kidneys play a big role here.
How so?
Kidneys activate vitamin D, but they also help get rid of the excess. As kidney function naturally declines with age, it's easier for vitamin D levels to get too high. This can cause that dangerous spike in blood calcium, hypercalcemia we mentioned, which can damage the kidneys themselves and cause serious heart rhythm issues, cardiac arrhythmias.
And you mentioned kidney function declining generally?
Yeah, overall kidney efficiency, what doctors measure as creatinine clearance, drops about 10% per decade after age 40.
10% per decade. That adds up. It really does.
Yeah.
And it means the body is slower at getting rid of excess amounts of other things too, not just vitamin D metabolites. Think water-soluble vitamins and minerals like potassium, magnesium, selenium. They can build up to toxic levels more easily.
So it really drives home that point. A standard senior multi just doesn't account for all this individual variation.
Not at all. It completely misses the complexity. You really need an individualized look.
Okay, this next part feels really critical, maybe even a bit scary. The interactions. Supplements and prescription drugs.
Yeah, this is a huge minefield. The average person over 65 is taking, what, 4 to 6 prescription meds?
At least, yeah.
You add supplements, even just a multivitamin, into that mix, and the chances for interactions just skyrocket. Some can be really dangerous.
And part of the problem is people don't think of vitamins as medicine.
Exactly. Dr. Patricia Rodriguez, a clinical pharmacist specializing in geriatrics, she sees it all the time. Seniors will list every single prescription, but forget to mention the calcium, the multi, the fish oil.
Because they think, oh, it's just a vitamin, it's natural, it's safe.
Right, which creates this huge blind spot for their doctor or pharmacist.
And are doctors and pharmacists always trained to catch these things?
Well, that's another layer. Often, medical and pharmacy schools don't spend a lot of time on supplements. So even if the patient mentions them, the provider might not recognize the potential interaction.
Okay, let's talk specifics. What are some common dangerous clashes?
The classic one, the one most people know, is vitamin K and warfarin,
The blood thinner?
right? Warfarin, like Coumadin. Vitamin K is essential for blood clotting, so taking extra vitamin K basically cancels out the warfarin.
Making it ineffective.
Totally ineffective, which dramatically increases the risk of stroke. We see cases like Harold, 78. His warfarin levels were stable for years, then suddenly went haywire. Turned out he'd started a new multivitamin with vitamin K.
And it's not always obvious on the label.
Sometimes it's hidden or is an herbal ingredient you wouldn't suspect. Very tricky.
What else? You mentioned calcium earlier.
Calcium is a big one for interactions. Take thyroid medication, like levothyroxine or Synthroid.
Very common.
Extremely common. Calcium can bind to levothyroxine in the gut and reduce its absorption by 20–30%.
That's significant.
Hugely significant. We had a case, Margaret Chen. Her long stable hypothyroidism suddenly got worse. The culprit, the calcium in her new senior multi.
So what's the rule there?
You absolutely have to separate them. Take calcium supplements at least 4 hours apart from thyroid meds.
4 hours, okay.
And calcium also interferes with certain antibiotics and drugs for osteoporosis called bisphosphonates. Same issue, binds them up, reduces absorption.
Okay, what about iron?
Iron's another binder. It can reduce the absorption of some antibiotics, Parkinson's medication, levodopa specifically, and even some heart drugs. Timing is critical.
Levodopa, isn't there another vitamin interaction with that?
Yes, good point. Vitamin B6, pyridoxine.
Right.
High doses, like the 25 to 100 milligrams you often see in B complexes or senior multis, can actually interfere with how well levodopa works.
Wow. So B6 is tricky. And didn't you say it can cause nerve damage too?
Yes, absolutely crucial point. B6 toxicity is real and often missed. Even doses as low as 50 milligrams a day, taken long-term, can cause peripheral neuropathy.
That numbness and tingling.
Exactly, in your hands and feet. And the scary part is it can be irreversible if it goes on too long. It often gets mistaken for, just aging or diabetic neuropathy or something else.
That's frightening. What about folate and B12?
Yes. Another subtle but dangerous one. High folate intake, common in fortified foods and supplements, can mask a B12 deficiency.
Mask it how?
It corrects the anemia, the blood abnormalities that often flag a B12 deficiency on tests.
So the blood looks okay.
Right. But the B12 deficiency is still there, silently causing neurological damage, nerve damage, cognitive problems. And by the time those symptoms become obvious, the damage might be permanent.
That is insidious.
It really is. Then you've got high-dose vitamin E.
What's the risk there?
Bleeding, especially at doses like 200–400 IU or more. If you're also taking aspirin or warfarin or another blood thinner like Plavix or Eliquis, that risk goes up significantly.
And then there are herbs.
Oh yeah, the herbal wildcards. Ginkgo biloba can increase bleeding risk. St. John's wort messes with the metabolism of tons of drugs. Green tea extract can interfere with blood thinners, iron. It adds layers of complexity.
So how widespread is this problem of interactions?
It's hard to pin down exactly because they often go unrecognized. But Dr. Michael Foster at Harvard estimates clinically significant interactions happen in at least 15–20% of seniors taking supplements.
15 to 20%? That's a lot of people.
It is. And many cases are likely missed because the symptoms develop slowly or they mimic other conditions.
And other things make it worse, right? Like companies changing formulas.
Exactly. Formulations change without notice. Quality control can be iffy. You might get more or less than the label says, or even unlisted ingredients. There's no real standardization between brands.
So what's the takeaway here? What can people do?
It really needs a multi-pronged approach. We need better patient education so you know to tell your doctor about everything you take.
Everything, not just prescriptions.
Everything. Vitamins, minerals, herbs, powders, teas. We need better training for healthcare providers so they know what questions to ask and what to look for. And frankly, the industry needs better oversight and standardization.
But until that happens.
Until then, you have to be your own advocate. Keep a detailed, up-to-date list. Meds, supplements, doses, everything. Share it with your doctor and pharmacist at every visit.
And be aware of your body.
Yes. Pay attention. If you start a new supplement and develop weird symptoms, or if a chronic condition suddenly gets worse, flag it up. It could be an interaction.
Okay. Let's shift gears slightly. We've talked interactions. What about just plain overdosing, taking too much of a vitamin itself?
Right. And when we say overdose with supplements in seniors, it's usually not like an acute poisoning from swallowing a whole bottle.
It's sneakier than that.
Much sneakier. Dr. Amanda Foster, a toxicologist, talks about chronic toxicity. It builds up slowly over weeks or months.
With vague symptoms.
Often very vague. Fatigue, nausea, maybe some pain. Things easily brushed off as just getting older or blamed on something else. But meanwhile, real damage could be happening.
Especially with those fat-soluble vitamins we talked about, A, D, E, K.
Exactly. Because the body stores them, they can accumulate. Water-soluble ones like B vitamins and C, the body mostly excretes the excess, though not always harmlessly, as we saw with B6. But A, D, E, and K can really build up.
Let's go back to vitamin A, hypervitaminosis A. How does that happen chronically?
It's surprisingly easy. Those common doses in senior multi, 2,500 to maybe 10,000 IU. Remember, the upper limit is around 10,000 IU or 3,000 micrograms RAE.
So some multis are right at the limit.
Some are close, or even slightly over, depending on the units used. And remember, seniors with iffy liver function can run into trouble at lower doses. Add in vitamin A from fortified foods, maybe liver once a week.
It adds up fast.
It does. That case of Robert Thompson, 69 years old, he was taking 13,000 IUs a day.
Okay, clearly over the limit.
Yes. And he developed bone pain, dry skin, fatigue, nausea, blamed on arthritis, dry weather, stress.
Standard stuff.
Until blood tests showed sky-high vitamin A. And the real kicker, he had significant irreversible bone loss directly caused by the vitamin A.
Irreversible. Wow.
Yeah. Vitamin A toxicity messes with bone remodeling.
Okay, what about vitamin D toxicity, that hypercalcemia thing?
Right. High blood calcium caused by too much vitamin D. Again, doses in supplements are often high. 4,000 to 4,000 IU is common now.
Plus what you get from fortified milk or sun.
Exactly. It can push calcium levels dangerously high. Symptoms can be severe. Nausea, vomiting, muscle weakness, confusion, serious heart rhythm problems, kidney damage. It can even be life-threatening.
And it creeps up on you.
It does. Dr. Sarah Kim, an endocrinologist, points out vitamin D has a long half-life in the body, so toxicity develops gradually. Symptoms might not show up until levels are really high.
And higher risk for some people.
Yes, definitely higher risk if you already have kidney disease or if you take certain diuretics, thiazide diuretics, which also affect calcium levels.
Okay. Iron toxicity. Who's most at risk there?
Primarily older men and postmenopausal women.
Because they're not losing iron through menstruation anymore.
Exactly. So iron can accumulate. Standard doses in supplements, maybe 18 milligrams in a multi, or higher doses like 65 milligrams if someone thinks they're anemic.
Can lead to overload?
Over time, yes. Chronic iron overload, and this is nasty stuff. It damages organs, the liver, leading to cirrhosis, the heart, causing heart failure, the pancreas, causing diabetes. It also increases cancer risk. It's basically hemochromatosis, but caused by intake rather than genetics.
Is there a case example for that?
Yes, Dorothy Williams, 71. Taking iron supplements, ended up taking about 93 milligrams a day total from different products.
Whoa.
Developed severe fatigue, joint pain, her skin darkened, liver enzymes went up, blood sugar started rising, again initially blamed on other things. Until a liver biopsy showed massive iron deposits and early cirrhosis. Permanent liver damage from taking too much iron.
Just devastating. And you mentioned even water-soluble vitamins aren't completely safe. We talked B6.
Right. B6 nerve damage, peripheral neuropathy from doses as low as 50 milligrams daily, long-term. Very important to remember.
Any others?
Niacin, vitamin B3. High doses can cause flushing, itching, sometimes liver damage, can raise blood sugar. That flushing can be really intense.
More than just uncomfortable.
For an older person, yeah. Severe flushing can cause dizziness, maybe even lead to a fall, which is a huge risk.
So preventing this chronic toxicity, it's tough because the symptoms are vague, it builds up slowly.
Exactly. And you're getting these nutrients from multiple places, supplements, fortified foods, plus the body's just more vulnerable with age.
But there are things you can do.
Absolutely. Knowledge is power here. Understanding that more isn't better. Being vigilant about your total intake. And talking to your doctor.
Can tests help?
Yes, blood tests can be really useful, especially if you are taking higher doses of fat-soluble vitamins like A or D, or minerals like iron. Monitoring levels can catch potential toxicity early before serious damage is done.
Okay, so wrapping this up, we've covered a lot of ground today.
We really have. I think the main takeaway is that senior vitamins, while they seem like a simple, healthy choice, are actually quite complex.
Yeah, the marketing promises simplicity, but the reality is different.
Very different.
Yeah.
Because the aging body is different. The way it handles nutrients changes. And the potential for interactions, for chronic toxicity, it's real.
So the goal isn't to scare everyone off supplements entirely.
Not at all. Some seniors genuinely benefit from specific targeted supplementation under medical guidance.
But it's about making informed choices, personalized choices, not just grabbing that senior formula because the label looks good.
Precisely. It underscores just how vital it is to have these conversations with your doctor or a knowledgeable healthcare provider.
So what does this all mean for you, the listener, moving forward?
Well, maybe the biggest insight, the real aha moment, isn't necessarily about figuring out which specific vitamin pill is best.
Okay.
But rather, it's about that profound shift in understanding. Recognizing that your body's needs are unique, and they change as you age, and realizing just how critical a truly personalized, careful, medically supervised approach to wellness really is.